Dr. Matez, tell me about the patients you see here at Sanctuary.
Oh, we see a very varied group of patients here. We see men and women. Predominantly our patient population is generally middle-aged people, but we do see younger people with hormonal imbalances and other problems related to aging. We have seen aging issues become more prominent in younger and younger people over the years due to a number of factors. So we are seeing a very varied group of people here.
Yeah, I had a hysterectomy at a very early age, and no one had explained to me what was going to happen. So I started having all these symptoms of depression, low libido, bad mood, couldn't sleep at night. The hot flashes were unbelievably bad. I could be somewhere and everyone is just sitting there with a sweater, and I'm the one trying to, get a fan or something to fan myself. Makeup running, not a good sign. So yeah, I didn't know all of this would happen with my hysterectomy, which I am so glad now that I had met Dr. Matez.
Now, a lot of the symptoms that your patients come to you with have a very emotional bend to them. When you talk about things like sleeplessness and depression and libido, those are hard things to bring up. How do you do that with your patients?
Absolutely. We do it by just basically being very upfront and straight about it. I think you'd be surprised to find that the majority of people that come to see me are actually pretty willing to talk about these problems because that's what they come in for. The other thing we do is we have a nice little symptom checklist so that they can do this without the embarrassment maybe of having to talk about it.
I noticed the hot flashes because I could see my makeup running and, just looking really bad. But the symptoms of depression and being in a bad mood, my husband just said one day, "You need to do something, Missy." That was that. Wow. And the kids were like, "Mommy, what's wrong with you?"
Now tell me about your first meeting with Dr. Matez.
Very thorough. Explained everything to me and took a very good interview as far as me giving him my symptoms, my age. He just took everything in consideration, what I do for a living, how long am I at work, because these hot flashes are driving me crazy. I mean, it's like, you're not crazy. You are in menopause. This is what's going on. I'm going to help you. And I'm just looking at him like, okay, just tell me what I need to do.
That must have been quite a visit.
It was. And he's just a great guy.
So when did you notice the difference?
About 2 months into trying the medication, because it's like trial and error at first. I mean, he's going to give you so much, and then you call him back and he checks up on you, so he knows, how are you feeling today, and with that in mind, he goes ahead and he'll pick it up, put it down. But right now I am definitely where I need to be, which is a good place.
Great. And your husband has noticed a difference?
Definitely. I mean, my libido is great. My children are out of the house. I'm in my second honeymoon now, and I'm having a good time.
That's fabulous. Congratulations.
Thank you.
Now, when you talk about hormones, though, there can be side effects, especially when testosterone is added to the mix, because that's the one that's generally associated with men. Mm-hmm. Have you noticed any side effects of acne or hair growth?
Nothing. If anything, my hair is growing better because it was falling out. I think all the stress and everything of all of that. I have good hair. I have a good sex life. I'm good.
And you have beautiful skin.
And I have beautiful skin.
Wow. What a fabulous result.
I know.
I'm very happy for you.
Thank you.